All right, so there you heard it. That was the Maharashtra Health Minister there assuring citizens that everything is under control, there's nothing to worry, and of course, giving out some tips as well. But for better understanding of the situation and also to understand what really is happening and what's the way forward, joining us on the broadcast are a panel of experts. Dr. Ishwar Gilada, who's an infectious disease expert and the Secretary General of the Organized Medicine Academic Guild, OMAG. Professor Dr. Sudhir Kumar, who's a senior consultant, neurologist, Institute of Neurosciences, Apollo Hospitals, Jubilee Hills, Hyderabad, and also Dr. Akash Singh, who's the associate consultant, BLK Max. Dr. Akash, I'll start with you now. We just heard the health minister in Maharashtra talk about the situation, and now the problem here is that while experts continue to say that there's nothing to be alarmed about, the problem is because of our experience with the COVID pandemic, anything to do with bacteria or virus creates a lot of alarm. Now, this started with just a small cluster of cases. Everyone told us, well, it's just a dozen cases, there's nothing to worry about. Then the cases went to 30, 40, 50, now it's crossed 110. Help us understand what really is happening on the ground.
Yeah, so there's a lot of difference between the COVID infection and this Guillain-Barré syndrome. See, this is primarily affects the male population, mostly in the adult age group, and the source of it, usually it's an autoimmune disease which is triggered by an infection, uh, most commonly Campylobacter jejuni, which actually gets through sources of water, poultry, and seafood. These are the common sources of infection for Campylobacter jejuni. So it's not like COVID, like it cannot spread from one person to another because the disease is autoimmune basically. So it's not spreading from one person to another, but there's a common point source which is responsible for this. So that needs to be identified and addressed first. Uh, Mostly, if people follow basic hygienes like clean drinking water, clean and potable drinking water, and properly cooked meat, if they are consuming meat, mostly poultry and seafood. So rest of the things can be taken care of. But yes, the problem with this disease is once it
But
happens,
Dr. Akash,
it
sorry
will
to interrupt
progress.
you, but again, how exactly is this spreading? Because not there are
So
111 cases in Pune alone now. Many people
yeah,
are on the ventilator. Now it's not like everyone drank water from the same well or everyone consumed chicken from the same shop. So clearly there is some sort of a spread that's happening that is beyond one particular source. So again,
yes.
how is
So
this happening and
I'll,
how
I'll
big can this get?
So this spread from one person to person is not there. That's what I said. The spread is among this the poultry population, right? So the chicken and the poultry farms will get infected. That can spread to different areas, and then people consuming those poultry can get infected. So the spread is not through person to person, but from
Okay.
the animal spread. That's how it's not just the point source; it's
All right.
basically spreading
Dr.
among
Gilada,
the animals.
that again brings me to the main point here. Dr. Gilada, now the question that here is being raised is about the contamination source. Now, we just heard the health minister there, and he is also of the opinion that water contamination is the major reason. Now, help me understand what is exactly the link between water contamination and this particular syndrome that we are looking at, and also how concerning is this? Because again, if water can be contaminated in one place, this could potentially spread to different areas as well. And again, if a larger body of water is contaminated, then this could lead to a larger infection.
Yeah, I am deeply concerned about the water supply. After 78, 79 years of
Correct.
independence, if we cannot provide a potable water to people, that too in a city situation, in municipal corporation, is pathetic. Though these couple of cluster of villages, they're part of the Pune Municipal Corporation, but still they are not getting PMC water supply. Now, if we talk about going on Mars and Moon and everything, and we are not able to supply potable water to people, it is pathetic situation. This is sometimes things are eye opener. That we open the eye and then we realize that there are so many infections spreading. When it's a waterborne infection, there will be so many infections
Correct.
like typhoid, cholera, hepatitis B, and so many other infections which are we think that they are under control, but they are not under control. Secondly, GBS is a almost
Right.
100-year-old infection disease, but till we do not know how it is exactly caused and how to prevent it. And that's the reason that these are the occasions where we need to study in deep that why in particular cluster of villages it's happening more than other places. It's very easy to say that GPS commonly happen all over the world it's happening in rest of the country. We every year see 2 3 cases in our practice. But why we are seeing 111 and maybe more cases in those couple of villages? So I think we need to look at that. Number two, we need to urgently provide
Right.
clean, potable water. We can't say that asking people to take clean water, boiled water. The people which are from a lower economic society, middle class society, we are asking them to have a lot of things to be done by themselves. As a society, as a government, we need to do that. And lastly, we need to see what
Absolutely.
best we can do in the current situation. Whether IVIG can be helping, we do not know the guarantee, but it's still to be provided. We need to see that a lot of people do not land up in on ventilator. If they are on ventilator, we need to see that they recover faster, and we need to reduce mortality and morbidity
Absolutely.
more. And a lot of things are not in our hand, but in a given situation, we need to do that. And this is a time we should study GBS properly.
Very valid points, Dr. Gilada, that you're talking about here. Now, the excuse that we are hearing from all the authorities is that this is not new. GBS has been around for a very long time, but the problematic thing here, which you're also pointing out, is that we still do not know the exact cause and we still do not know how to contain it. And I think that exactly again goes on to show how weak the entire system is. The fact that this is something that's spreading through water supply and we're still not able to control it. And again, that brings me to the next point here, and something that a lot of people today are concerned about. Dr. Sudhir Kumar, now you are a neurologist, you understand how really this particular syndrome progresses. Now, we just spoke about a particular case, the death of a CA. It started off with the person feeling some sort of a tingling sensation in the body. It then went to some sort of a weakness, and then it went to paralysis, and then death. It's scary, the progression of this disease. If you can help our viewers understand what are the early signs that one can watch out for. From what I understand, diarrhea. Now, there could be many reasons why the person could have thought he had diarrhea, but then not he would have, I'm sure he did not expect GBS to be the reason. So what are the early signs that people can watch out for?
Yeah, so basically, GBS is not an infection, it is a post-infectious syndrome. So basically, this infections, underlying infections can be a viral fever, or it can be respiratory infection, or it can be a gastrointestinal infection. So first, the person has symptoms of infection. In this case, we
Correct.
know that many cases have Campylobacter jejuni, which is a gastrointestinal infection. So the person who suffers from this, they will have stomach pain, cramps, loose stools, and then generally there is a gap of say 7 to 14 days after the infection. The person, the GI symptoms will subside. And what happens? Our body tries to mount an immune response. Whenever we are infected, our body fights the infection by producing antibodies. So in this condition, in GBS, what happens is these abnormal antibodies, instead of attacking the bacteria or the virus, they attack the own nervous system. And that is what happens in GBS. So it happens about 7 to 14 days after the infection has already subsided. So at that point, the person is not infected as such. And then the first symptoms, usually it starts in the feet. So the person has tingling or numbness in the feet, and within few hours or few days the symptoms start getting worse. They have weakness in the legs, and then it ascends up the truncal weakness. The person may have difficulty in turning on the bed, and then the hands, upper limbs, they get weaker, and finally difficulty in speaking, swallowing, and in some people they can have respiratory failure requiring ventilation. So generally people get few hours or few days time, they can see the
Okay.
progression. And as all of us have pointed out, that once the persons are in the initial stage of symptoms and they seek treatment, then treatments are highly effective. Only in the severe cases who have already gone to ventilator, or there is something called autonomic dysfunction where the heart rate and blood pressure starts fluctuating. In those cases, there is a risk of death. But with proper treatment at the early stage with immunoglobulins or plasma exchange, almost 95% people survive. Even now, out of 100 odd cases, only one death has been reported. So we don't need to panic, but we have to recognize the symptoms at early stage so that treatment can be started as early as possible.
Absolutely, absolutely. Dr. Sudhir, I totally understand there's no need to panic, and none of us here on the panel is trying to be an alarmist. But the problem here is that we still do not have an effective solution on containing this particular issue. And again, given the fact that this is through water supply, water contamination that it's happening, it makes it even more concerning. And talking about concerns among the people of Pune, also joining us is Anuj Mungali, who's a trustee of Sanskriti School Pune. Anuj, Now I understand you are in a business, an industry which is very consumer facing. A lot of queries from parents as well coming in, and a lot of citizens across Pune also concerned right now. What are the sort of reactions that you're looking at across Pune? Because now, initially people were asked not to worry because it was just a dozen cases, but now this has gone past 100. So what are the sort of concerns that you're looking at?
I think having the country just having gone through a pandemic, there's overall a fear when any new disease or any new infection or a post-infection response starts off and it starts spreading across the city. There is a basic sense of panic and worry amongst, I think, everyone amongst the citizens, because we've just gone through something which was rather devastating for the entire world. So people are panicking, and as the esteemed doctors in the panels have already stated, that there isn't a lot that is currently known as to what is the cause for the spread or as to what is the line of treatment for that. So there isn't much known for a lot of people to comment on that. But I would say, as an institution where
Right.
being associated with an institution where children are being taught, and it's our duty to inculcate general good practices where the cause can be something as simple as a flu, and then your body fighting against that is causing the disease. So general hygiene practices have to be followed, and even more so in institutes, in places, in public places where there are a large number of people congregating. So currently, we as an institute have implemented recheck, gone through again all the hygiene protocols, checking the water sources. So we've doubly ensured that, and that is something that is done through the year. So I think maintaining better hygiene levels
Absolutely.
across and getting the kids to follow the practices at home, carrying the message further is what we know right now can prevent it and keep it at bay for sure until there's more medical advice that comes to that effect. There isn't much that one can actually, it's all guesswork post that.
Absolutely, absolutely, Anuj. And also, what makes it worse is the fact that this does not have any distinctive symptoms. It's almost the same as any other flu or virus that you might have. And again, it's only at the later stages that you really understand what really is going on. And by the time, like Dr. Sudhir also pointed out, that the effectiveness of the treatment also fades away. Dr. Gilada, you were making a very interesting point earlier. You were saying that yes, the overall numbers might not be that concerning, one death in 111 cases. But the problem here is that this is spreading via water supply. It's a case of water contamination. And again, the fact that we are still not able to control it brings in focus a larger issue. What if this happens in a larger water body? Now, this happened in a small little well near Pune. Over 100 people are infected. We don't know how many more are infected. What if it happens in a larger water body? There could be hundreds and thousands of people that might be affected. Do you think we have the mechanism in place to ensure that something like that does not happen?
When our country got independence, we were totally poverty stricken. And we spent almost 20 years' time in roti kapda makan. Then another 20 years' time we spent on bijli sadak pani. Then another 20 years we spent on education and health. And we are going back to pani. We always talk about tanker Maharashtra, tanker Gujarat, tanker but still there are tankers. Still we do not have potable water. And if as a medical student I learned 50 years back, 45 years back, chlorination. It's a simple chlorine. That's not happening. And if Dr. Sudhir said that 9 to 14 days is the period, we started first case on 9th of January. We are already 20 days ahead. So that means if we knew the first case of 9, and we knew the water supply, we knew there's some problem, then the next cases should not come. So I think in the problem versus action,
Correct.
something is lacking. And why only from a couple of villages? Because if we are looking at current cases, they are from those villages. People are now vigilant everywhere. That many number of cases are not happening. So there is some association which is missing. That missing need to be found. And from now onwards, if we find that air is not clean, water is not clean, food is adulterated, then what do we guarantee our people? So I think something we need to do on a war footing, and we need to provide a very good, clean water supply to people. That's a basic minimum need. Rest of the things can come later. And you ask one question.
Again, Dr.
What can
Sudhir,
happen in a big way?
that again brings me.
One hepatitis B pandemic, which happened in
Absolutely.
West Bengal.
That was the point that I was asking Dr. Gilada. What if this happens in a larger water body?
That's what I'm coming
If
to.
what you're saying, if I go by your word right now, it's a massive concern.
Yeah, you see, in 1970s or so, in West Bengal, major hepatitis B pandemic happened, or epidemic happened. How it happened? When the water supply and kind of sewage supply, they are together. Water supply is not a 24/7. So when water is not supplied, it is in a negative pressure. And if there's a breakage in the sewage line, it will suck up the sewage and it get contaminated. That's what has happened. From that time, whenever there are pipelines, they put one side of the road pipeline for water, other side is the sewage. So there are issues, and you can find out. Yeah, you don't have to do a lot of surveillance. You do sewage water surveillance and find out what infections are going on. Currently, they found Campylobacter jejuni, and probably that infection was not associated earlier in a big way. Now it is. So we need to look at that.
Correct. Absolutely. And also, Dr. Sudhir, I really wanted to ask this because this was a concern that a lot of people that I spoke to about this particular issue also raised. What are the long-term effects of this particular syndrome, the GB syndrome? Because this affects your nervous system. And if it affects your nervous system, even if a person is cured, there could be some sort of a long-term effect that the person could witness.
Yes, so GBS is not uniform. So, like in some people, the effects are mild, so they may have mild weakness, mild numbness. So, almost luckily for us, 50% of GBS cases are milder variety where they may not get completely paralyzed or they may not go on to ventilator. So, such people have good recovery in the next, say, 6 to 8 weeks. They'll be back on the feet and they can do everything normally. But the balance 50% of cases can be having severe symptoms. So, they can remain paralyzed or they can remain weak for several months and they require physiotherapy and rehabilitation. But the good thing I would like to say here is that it's a treatable condition and recoverable condition. And most people say more than 80% people do
But Dr.
recover.
Sudhir, you say it's a treatable condition. From what I understand, the injections are very costly. I correct me if I'm wrong here. I just have a ballpark figure: 20,000 per injection. That's what I'm hearing. It's a very costly treatment.
Yes, I think you're absolutely correct. So treatments are there and they're effective treatments, but they are costly. Both IVIG injections, immunoglobulin injections, as well as plasma exchange, they're expensive treatments. And poor people, say our middle class, also they cannot afford. And we have heard from Maharashtra government that they have agreed to provide it free of cost or in their insurance scheme it will be covered. So that is that message we need to convey to public that for the lack of funds, they did not wait at home. They should go to the hospital and they'll be covered by the health insurance of the government.
Absolutely. Right. What's more concerning here is that India cannot afford a GBS sort of a syndrome on a larger scale. Just purely looking at the sort of treatment cost that we're looking at, 20,000 per injection, and imagine the number of people that might get infected if it happens in a larger body. So clearly, like Dr. Gilada said, there is a missing link here that needs to be identified. Yes, we're trying to contain the diseases, we're trying to treat the people who are already infected, but the missing link about how exactly this spreads and what's the source of it, I think that has to be established, and that should be the priority of the concerned authorities. Dr. Gilada, Professor Sudhir Kumar, and Dr. Akash Singh and Anuj Mungali, really appreciate you joining us on the broadcast here for this very insightful discussion and something that I'm sure a lot of people, not just in Pune, not just in Maharashtra, but across the nation might be concerned about. We'll of course keep a very close eye on all the developments as far as GPS is concerned. On that note, it's a wrap on this edition of Mirror Prime. Lots more line up on the other side. Stay tuned.